Now, we are pleased to welcome our Honorable Prime Minister, Shri Narendra Modi ji, on the dais. May I now request Shri Deepak Kumar, Director General of ESIC, to welcome our Honorable Prime Minister by presenting a bouquet. திரு தீபக் குமார், தலைமை இயக்குனர், தொழிலாளர் அரசு காப்பீட்டுக் கழகம், பூங்கொத்தினை நமது பிரதமர் அவர்களுக்கு வழங்குகிறார். நன்றி அவர்களுக்கு. May I now humbly request திரு பொன் ராதாகிருஷ்ணன், Union Minister of State for Road Transport and Highways and Shipping, to present the welcome address.
அனைவருக்கும் அன்பான வணக்கங்களை தெரிவித்துக் கொள்கின்றேன். Most Honorable Prime Minister of India, Shri Narendra Modi ji, His Excellency Dr. Roshaya, Governor of Government of Tamil Nadu, Shri Bandari Dattatreya, Honorable Minister of State for Labour and Employment, Government of India, Thirupi Sellumani, Honorable Minister for Municipal Administration, Government of Tamil Nadu, Thirupi Mohan, Honorable Labour Minister, Government of Tamil Nadu, Dr. C. Vijay Bhaskar, Honorable Health Minister, Government of Tamil Nadu, Thirupi Nagarajan, Honorable Member of Parliament, Secretary, Union Ministry for Labour and Employment, Director General ESIC, officers from central and state governments, other distinguished guests, media persons and ladies and gentlemen, அன்பிற்குரிய பெரியவர்களுக்கும் அனைவருக்கும் என்னுடைய வணக்கங்களை தெரிவித்துக் கொள்கின்றேன். I am privileged to welcome you all for yet another milestone in the history of Employees State Insurance Corporation under the dynamic leadership and able guidance of our Honorable Prime Minister, who is here to inaugurate and hand over the newly constructed building of ESIC Building Medical College Hospital, Coimbatore to Tamil Nadu government. இந்த அற்புதமான ஒரு மருத்துவமனையும் கல்லூரியையும் கட்டி முடித்து தமிழக அரசாங்கத்திற்கு வழங்க வந்திருக்கின்ற நம்முடைய பிரதமர் நரேந்திர மோடி அவர்களை மனப்பூர்வமாக இரு கரங்கூப்பி நாம் மகிழ்ச்சியோடு வரவேற்கின்றோம். அத்தோடு இங்கே வருகை தந்திருக்கின்ற அனைத்து பெரியவர்களையும் கூட நாம் வரவேற்கின்றோம். இஎஸ்ஐ மருத்துவமனை என்று சொல்வது மரபுசாரா தொழிலாளர்களுக்காக அமைக்கப்பட்டிருக்கின்றது. நம்முடைய அரசாங்கம் பல்வேறு திட்டங்களை நம்முடைய பிரதமர் நரேந்திர மோடியுடைய தலைமையிலே தொழிலாளர்களுடைய முன்னேற்றத்திற்காகவும் அவருடைய குடும்பங்களுடைய முன்னேற்றத்திற்காகவும் கொண்டு வந்திருக்கின்றது. அதில் மிக முக்கியமாக அவருடைய சுகாதாரத்தை பேணுகின்ற வகையிலே இந்த இஎஸ்ஐ மருத்துவமனை போன்றவைகள் அமைக்கப்பட்டிருக்கின்றன. தற்போது மத்திய அரசாங்கத்தினுடைய தொழிலாளர் துறையின் மூலமாக நடத்தப்பட்டு கொண்டிருந்த இந்த மருத்துவமனை நம்முடைய மாநில அரசாங்கத்திடம் ஒப்படைக்கப்பெற்று வருங்காலத்திலே கோயம்புத்தூர், திருப்பூர் போன்ற பகுதியில் இருக்கக்கூடிய பல்லாயிரக்கணக்கான நம்முடைய தொழிலாளர்களுக்கு பயன் தரக்கூடிய வகையிலே அமையிருக்கின்றது. ஆகவே இன்று இந்த நிகழ்ச்சியிலே வருகை தந்து நமக்கெல்லாம் பெருமை சேர்க்கக்கூடிய வகையிலே இந்தியாவை உலகினுடைய முதலில் நாடாக அழைத்து சென்று கொண்டிருக்கின்ற நம்முடைய பிரதமர் நரேந்திர மோடியுடைய கையினாலே இது திறக்க வைக்கப்பட்டிருப்பதிலே நாம் மகிழ்ச்சி அடைகின்றோம். வரும் காலத்திலே நம்முடைய தொழிலாளர்களுக்கு மேலும் சிறப்பு சேர்க்கக்கூடிய வகையிலே ஏராளமான திட்டங்களை நம்முடைய பிரதமர் நரேந்திர மோடி அவர்கள் வழங்குவதற்கு தயாராக இருந்து கொண்டிருக்கின்றார்கள். அதற்கெல்லாம் முதல் துவக்கமாக இந்த நிகழ்ச்சி அமைந்திருக்கின்றது. இந்த நிகழ்ச்சியின் மூலமாக நம்முடைய கோவை மற்றும் சுற்றுவட்டாரத்தில் இருக்கக்கூடிய அனைத்து மக்களும் மிகப்பெரிய அளவிலே பயன்பெறக்கூடிய வகையில் அமைந்திருக்கிறது என்பதை மகிழ்ச்சியோடு தெரிவித்துக் கொள்கின்றோம். இந்த வளாகம் 1,33,000 சதுர மீட்டர் பரப்பளவிலே அமைக்கப்பட்டிருக்கின்றது. ஏறக்குறைய 580 கோடி ரூபாய் செலவிலே அமைக்கப்பட்டிருக்கின்றது. இந்த மருத்துவமனையில் எப்பொழுது வந்தாலும் சிகிச்சை கொடுக்கக்கூடிய வகையில் ஏற்பாடுகள் செய்யப்பட்டிருக்கின்றன. சிறப்பு ஏற்பாடுகள், நோயாளிகளுக்கான சிறப்பு ஏற்பாடுகளும் வழங்கப்பட்டிருக்கின்றன. இந்த வளாகம் வருங்காலத்திலே நம்முடைய தொழிலாளர்களுக்கு வேலை செய்யக்கூடிய உந்துதலை மேலும் கொடுக்கக்கூடிய வகையில் உறுதியாக அமையும் என்கின்ற நம்பிக்கையோடு இங்கே வருகை தந்திருக்கின்ற அனைவருக்கும் எங்களுடைய வணக்கங்களை தெரிவித்துக்கொண்டு இந்த நிகழ்ச்சியிலே வந்து கலந்து கொண்டிருக்கின்ற நம்முடைய மரியாதைக்குரிய பிரதமர் நரேந்திர மோடி அவர்களுக்கும் மரியாதைக்குரிய அனைத்து பெரியவர்களுக்கும் என்னுடைய வணக்கங்களை தெரிவித்துக்கொண்டு இந்த நிகழ்ச்சிக்கு வந்தமைக்காக நன்றி கூறி பிரதமருக்கு மீண்டும் மீண்டும் நன்றி கூறி அமைகின்றோம். நன்றி, வணக்கம்.
Thank you, sir, for your welcome address. May I now humbly call upon Thiru Bandaru Dattatreya, Union Minister of State, Independent Charge for Labour and Employment, to address the august audience.
Vanakkam. Honorable Prime Minister Shri Narendra Modi ji, His Excellency Governor of Tamil Nadu Shri Roshaya Garu, and esteemed guests and dais, invitees, members of our ESIC family, including insured persons who are our VIPs, friends from members of media, ladies and gentlemen. Today, I am very privileged to honor to be part of the August gathering where the Honorable Prime Minister is present on the auspicious occasion of inauguration and handing over of newly constructed ESIC Medical College and Hospital building in this famous industrial city of Coimbatore. As the Chairman of Employees State Insurance Corporation, I feel very proud to mention that ESIC is the only social security organization in India which provides multiple benefits to the insured persons and their beneficiaries covered under the ESI scheme. We will know that the ESI scheme for the last 64 years is providing comprehensive medical care and certain cash benefits to its beneficiaries. ESI scheme is unique, perhaps unparalleled in the world. I must say that India is now coming of age in field of healthcare with the expanding infrastructure, harnessing existing emergency technologies for affordable healthcare, using our abundant heritage of traditional medicines and exploring the new paradigms for preventing the disease and creating wellness, and do our delight. ESIC has been doing its silent for over 66 decades. Ever since its inception, the post-independence era, with India's first Prime Minister, Pandit Jawaharlal Nehru, as the first insured person of ESIC. It is a matter of great pride for all of us that ESIC has today embarked upon a glorious journey, now completing its 64 glorious years in the service of our great nation on 24th February. It is heartening to see that the commitments made to its stakeholders are being fulfilled by ESIC. ESIC has become one of the largest social security organizations, offering a better and brighter tomorrow for all ESIC beneficiaries, making every insured person feel like a VIP. I am happy to note that ESI dispensaries and super specialty hospitals offer world-class treatment to the insured persons and their families. ESI has so far set up 151 hospitals, 1,459 dispensaries, and 188 ISM units, and payment of cash benefits. The ESIC operates through a network over the 61 regional office, sub-regional offices, and divisional offices, 621 branch offices, and 185 pay offices situated all over the country. Our government under the leadership of Honorable Prime Minister, has interest of workers as its utmost concern and committed to work for the welfare of workers and improvement in their quality of life by providing all possible amenities to them. ESIC is modernizing and constantly upgrading the facilities and has embarked upon initiatives for providing the high quality services. I am very proud to mention that Sri Narendra Modi ji, Honorable Prime Minister, launched ESIC second generation of health reform agenda on 20th July 2015. The silent features are online availability of electronic health records of insured persons and their family members, ensuring the change of bed sheet every day in ESIC hospitals according to the WIPGAR pattern as a part of Swachh Bharat mission. Every evening, OPD in ESIC hospitals for senior citizens and disabled persons. Medical helpline 1800-113839 for emergency and seeking guidance from the ESI hospitals. ESIC has recently launched its hospital's website, which facilitates the insured persons to book online appointment with a doctor of a particular discipline spread across 36 ESIC hospitals from anywhere, anytime. I feel very proud to mention that during the last 1 year, the new government, under the leadership of Honorable Prime Minister, has initiated many actions to bring efficiency, transparency, and accountability in the functioning of the ESIC. Under the Digital India initiative, ESIC has launched e-governance project in its various operations, which includes the initiatives like Project Panchadeep, Pehchan Card, Employer Portal, and IP Portal. Aimed at employers, ESIC has initiated the payment of ESIC contribution through net banking. For achieving the object of simplifying business regulations and bringing in transparency and accountability in labor inspection, the inspection scheme of ESIC has been integrated with the Shram Suvidha portal of Ministry of Labour Employment. ESIC has become first organization to integrate its services. It is a registration employers through the e-Bits portal, Department of Industrial Policy and Promotion, for furthering the cause of ease of doing business and reducing the cost of transaction. ESI scheme was first implemented in the state of Tamil Nadu in Coimbatore in its suburbs on 21st January 1955, followed by Chennai and its suburbs in November 1955. Thereafter, the scheme has progressively been extended in other industrial centers. It is mentioned that ESIC Sub-Regional Office in Coimbatore started functioning from January 1990 with jurisdiction of districts of Coimbatore, Erode, Tirupur, Nilgiris. 18 branch offices, 50 dispensaries are functioning under the ESIC Sub-Regional Office, Coimbatore. ESIC scheme is implemented in 25 centers within the jurisdiction of Coimbatore sub-region, and ESIC scheme has implemented in 18,770 factories and establishments with more than 6.15 lakh insured persons. Friends, this medical college was conceived to directly run by the Employees State Insurance Corporation, but the present government at the center has taken the decision to hand over the college to the state government, and today the college building is being officially handed over to the government of Tamil Nadu. This shows the spirit of cooperative federalism practiced by Government of India under the Prime Minister Sri Narendra Modi ji. I am sure the new medical college and the ESI associated with its building at cost of 580 crore will be boon to the ESIC insured persons and their family members in and around Coimbatore and Tamil Nadu. Friends, Ministry of Labour and Employment, Government of India has taken a number of initiatives the legislative reforms. We have amended Bonus Act, which has increased a wage ceiling from 10,000 to 21,000 and benefit ceiling from 3,500 to 7,000, or a minimum wage of scheduled employment, whichever is higher. Here, I would like to profusely thank Honorable Prime Minister who directed this benefit be extended to our workforce retrospectively with effect from 1/4/2014. We are also bringing amendments to the Child Labour Act, Maternity Act, and bring them in tune with the times. Under Samasuvidha portal, lean employers and arbitrary inspection, computer-based inspection scheme has been put in place for bringing the transparency, where inspection reports are to be uploaded mandatorily within 72 hours. My priority is to work putting in place a social security net for the unorganized sector in India, which constitute 93% of the workforce, numbering 45 crores. My ministry is working on this. I would once again like to reiterate our commitment to provide the best possible services to our beneficiaries through use of technology so that they are healthy and productive and are able to give the best development of our national economy. Last but not the least, I express my deep sense of gratitude to each one of you for reposing your trust and confidence in all the schemes and policy framework of ESIC, for which you deserve a thundering applause from my side. I sincerely thank the Honorable Prime Minister for blessing this occasion and assure that we in the Ministry of Labour and Employment are working to realize the vision of Honorable Prime Minister of taking India to greater height. I also thank His Excellency and all dignitaries on the dais and all of you for being present on the occasion. Jai Hind.
Thank you, sir. Now is the time of handing over the state-of-the-art ESIC Medical College and Hospital by our Honorable Prime Minister to the Government of Tamil Nadu. Our Honorable Ministers of the Government of Tamil Nadu, Thiru P. Mohan, Thiru S. P. Velumani, and Dr. C. Vijayabhaskar are requested to receive the scroll. இப்பொழுது நமது நிகழ்ச்சியில் ESIC மருத்துவக் கல்லூரி மற்றும் மருத்துவமனையின் பட்டயம் ஒப்படைப்பு நிகழ்வுக்கு நமது மாண்புமிகு பிரதமர் பட்டயத்தினை நமது தமிழக அரசின் மாண்புமிகு அமைச்சர்களுக்கு வழங்குகிறார். अनेवरकुम नंद्री. देवियों और सज्जनों, अब प्रतीक्षा की घड़ी समाप्त हुई. हम लोगों के लोकप्रिय, करिश्माई, ऊर्जावान और जनप्रिय नेता, जिनके नेतृत्व में हमारा देश बहुत तेजी से प्रगति और विकास के पथ पर अग्रसर है और विश्व के पटल पर अपनी पहचान बना रहा है, हमें संबोधित करेंगे. मैं विनम्रतापूर्वक माननीय प्रधानमंत्री जी से अनुरोध करती हूँ कि वे हमें संबोधित कर हमारा मार्गदर्शन करें. நாம் எதிர்பார்த்து கொண்டிருந்த தருணம் வந்துவிட்டது. யாருடைய தலைமையில் இந்திய திருநாடு வேகமான வளர்ச்சியும் முன்னேற்றமும் கொண்டுள்ளதோ, மேலும் இந்தியாவை உலக வரைபடத்தில் ஒளிர செய்தாரோ, அந்த புகழ்பெற்ற நேசத்திற்குரிய எல்லோராலும் போற்றப்படக்கூடிய மக்களின் தலைவர் தற்போது நம்மிடையே பேச வருகிறார். நம்முடைய மாண்புமிகு பிரதமர் அவர்களை பேச வருமாறும் அவருடைய மதிப்புக்கு வழிகாட்டுதலுக்கு எங்களுக்கு அளிக்குமாறும் பணிவுடன் வேண்டுகிறோம்.
வணக்கம். இன்று கோவை மாநகரமா வந்ததில் மகிழ்ச்சி. गवर्नर डॉक्टर के रोसैया जी, मंत्रिपरिषद के मेरे साथी श्रीमान बी दत्तात्रेय, श्रीमान पोन राधाकृष्णन जी, श्रीमान पी मोहन जी, श्री एस पी वेलुमणि जी, डॉक्टर सी विजय भास्कर, श्रीमान पी नागराजन, श्री शंकर अग्रवाल जी, ESIC डायरेक्टर श्रीमान दीपक कुमार और विशाल संख्या में पधारे हुए सभी महानुभाव, I have a great pleasure to be with all of you at Coimbatore, the textile capital of South India and the commercial hub of Tamil Nadu, to inaugurate the newly constructed building for the medical college and the hospital. On this occasion, the central government has also handed over the existing hospital, the medical college, and related buildings to the government of Tamil Nadu. It reinforces my government's commitment to cooperative federalism. I hope that the government of Tamil Nadu will act quickly to start the college. This project, worth 580 crore rupees, will be a boon to ESIC beneficiaries and their family members in and around Coimbatore. Of the 100 MBBS seats proposed here, 20 seats will be reserved for the children of persons insured under the ESI schemes. We should strive to make this medical college and hospital a model for high quality medical education and treatment to workers of the Tamil Nadu state. My government is committed to the development of a generous and comprehensive social safety net for all the workers. For the over 45 crores unorganized sector workers, in addition to the RSBY health insurance program, we have started the Pradhan Mantri Jeevan Jyoti Bima Yojana, Pradhan Mantri Suraksha Bima Yojana, Atal Pension Yojana to provide life and accident insurance. This commitment to the builders of modern India comes from the firm belief that a swastha and samruddha samik will make a samruddha rashtra. We have initiated major reforms of the EPFO and ESIC for the benefit of organized sector employees. A universal account number has so far been allotted to over 6 crore sector workers, enabling portability of their EPF accounts. Further, we propose to expand coverage and offer additional facilities and services through the ESIC. The ESI scheme is based on the Gandhian principle of contribution as per the ability and benefits as per the requirement. This principle entitles an insured person or their family members to uniform benefits, though only paying a contribution proportionate to his or her wage. Apart from medical benefit, ESIC also provides sickness, disablement, dependence, maternity, and unemployment allowance benefit to the insured persons. Its unique character, with no restriction on the expenditure and instances where more than 30 to 40 lakh rupees have been spent on treatments. It means that ESIC health scheme has been a boon to millions of workers. Friends, from its modest beginning in 1952, with just 2 centers in Kanpur and Delhi, the ESI scheme today is implemented in 830 centers in 34 states and union territories. It covers over 7 lakh factories and establishments across the country and benefits to 2 crore workers and about 8 crore beneficiaries. In Tamil Nadu, the scheme has over 85,000 participating employers and over 28 lakh insured persons. Coimbatore itself having nearly 27,000 employers. It is available in 31 districts of Tamil Nadu. There are 10 ESI hospitals in Tamil Nadu. After handing over this hospital, there will be 8 ESI hospitals in the state run by the state government. The ESIC hospital, Tirunelveli, is proposed for upgradation from 50 to 100 beds. There is a large network of 201 ESI dispensaries in the state for outpatient treatment for the insured persons and their family members. Coimbatore itself had 50 dispensaries. My government is dedicated to the welfare of our brothers and sisters who are our Rashtra Nirmatas. Sensing the need for expansion of ESIC, I had launched a second generation reform agenda named ESIC 2.0. In July last year, during the Indian Labour Conference held in New Delhi, the coverage of ESI scheme has been extended to the remaining northeast states, Arunachal Pradesh, Mizoram, Manipur, and Nicobar Island. It is proposed to expand the coverage from only the industrial and commercial clusters within a district to the entire district by 31st March 2016 this year. Since 1st August last year, the scheme has been extended to construction workers. I strongly believe in the improvement of public service delivery standards. In keeping with this, several initiatives have been started to improve the quality of service delivery in ASI hospitals. They include online availability of the electronic health record of ESI beneficiaries, establishment of an emergency medical helpline, and creation of special outpatient services for senior citizens and differently able persons in SIC hospitals. To improve cleanliness, the Abhiyan Indradhanush changes bed sheets according to the rainbow pattern each day of the week. Cleanliness is an important aspect of preventive health care. Studies show that it can lead to saving of almost 7,000 rupees per year per poor family. Among other initiatives, the ESIC has resolved to adopt 2 model hospitals in each state apart from a mother and child care hospital. I am happy that ESIC proposes to expand coverage by complementing its own services with public-private partnership. Apart from cancer detection, cardiology treatment, and dialysis, the corporation also proposes to offer in a phased manner pathological and X-ray facilities in all its dispensaries through PPPS. Besides allopathic treatment, ESIC hospitals will also provide Ayush treatment in a phased manner. Friends, my government has taken a number of path-breaking steps for the welfare of workforce of our country. From September 2014, we have revised the Employee Provident Fund Organization, EPFO, pension to minimum of 1,000 rupees per month. The wage ceiling for EPF benefits has been raised from 6,500 to 15,000 rupees since 1st September 2014. An EPFO mobile app has been launched for easier access to its services for both workers and employers. The Bonus Act has been amended to increase the ceiling for eligibility and bonus payable to 21,000 and 7,000 rupees per month respectively. Keeping in mind our commitment to minimum government, maximum governance, the ministry is simplifying central labor laws by consolidating the existing 44 laws into 4 labor codes, namely on wages, industrial relations, safety and security, and health. This would considerably increase the ease of doing business and facilitate job creation without compromising on the genuine protection and rights available for our workers. We are progressing on the reform path by building consensus on these reforms through extensive stakeholders consultation with employers, workers' representatives, and state governments. A Shram Suvidha portal has been created for online services related to 16 labor laws, including a process of transparent and random inspection of businesses. A lean number has been issued to nearly 1 million employers, enabling them to process single online filing on 8 labor laws. The services offered by ESIC and EPFO have been integrated with the e-business portal of the Department of Industrial Policy and Promotion. to promote ease of business and limit transaction costs. Further, it is proposed to promulgate new EPFO and ESIC Act, providing more choice, increased coverage among workers and employers, and better and expanded range of services for organized sector workers. Our plans to expand ESIC facilities, indeed the establishment of this medical college itself, is a part of a larger plan to upgrade the facilities for medical education and specialized care. We have also approved a scheme for upgradation of existing state and central government medical colleges to increase MBBS seats. Through this, we hope to increase 10,000 MBBS seats and support the college with funds for equipment and infrastructure. So far, 23 medical colleges have been approved to increase over 1,700 MBBS seats. I am happy to inform that 4 state government medical colleges in Tamil Nadu, at Coimbatore, Kanyakumari, Tirunelveli, and Madurai have been approved for upgradation by adding 345 more MBBS seats. With similar objective, we are also promoting the establishment of AIIMS-like institutions across the country. One such institution has also been approved for Tamil Nadu, and with the active support of the state government, I hope this institution will start admissions quickly. Friends, we all know that the father of the Constitution is Bharat Ratna Dr. Babasaheb Ambedkar. But not many of us are aware of the immense contribution made by Babasaheb to the formulation of our labor laws. I am therefore happy to inform that Ministry of Labor and Empowerment organized a conference in Delhi last month to commemorate the 125th birth anniversary year of Dr. Babasaheb Ambedkar. I urge each one of you to read the booklet Dr. B.R. Ambedkar, Labor Welfare and Empowerment, initiative to make his vision a reality, which was released on that occasion. We are committed to resolve to work collectively and collaboratively to realize the vision of Dr. Babasaheb Ambedkar for labor welfare. Friends, industrial peace and harmony can be achieved only when the goals of employment and employability are in tune with the goals of industrial development and growth. It is our shared vision to have an environment which is conducive for inclusive growth and development of the country. I assure the state government all the cooperation from the central government in all its efforts in this direction. I am encouraged to work more for the welfare of the workforce of India and strive towards making India a better workplace for all. Let us all come together in making our country the best place to work and live in. Jai Hind. Thank you very much.
பெரியோர்களே, தாய்மார்களே, நாம் இப்பொழுது நம்முடைய பிரதமரின் சொற்பொழிவை கேட்டோம். நாம் அவருடைய அன்பான வார்த்தைகளுக்கு நன்றி சொல்ல கடமைப்பட்டுள்ளோம். நாட்டின் முன்னேற்றத்திற்கும் வளர்ச்சிக்கும் அவர் நம்மை வழிநடத்தி செல்லுதலுக்கும் நாம் நன்றியை உரித்தாக்குவோம். மாண்புமிகு பிரதமர் அவர்களே, தங்களின் வார்த்தைகள் மக்களை காப்பதற்கு நல் வழிகாட்டியாக அமையும் என்பதில் ஐயமேதுமில்லை. Ladies and gentlemen, we have just heard our Honorable Prime Minister. We are indebted and thankful to him for his kind words. We are thankful to him for showing and leading the path to development and growth of the country. Honorable Prime Minister, your words will provide the right guidance to serve the people. May I now humbly call upon Shri Deepak Kumar, Director General, ESIC, to present the vote of thanks. இப்பொழுது நன்றி உரையாற்ற ESIC தலைமை இயக்குனர் திரு தீபக் குமார் அவர்களை அன்போடு வரவேற்கிறோம்.
On this occasion of inauguration of newly constructed building of ESIC Medical College and Hospital at Coimbatore, I on behalf of ESIC take pride and privilege in thanking the Honorable Prime Minister for inaugurating this newly constructed building of ESIC Medical College and Hospital. I also thank Dr. K. Rojaiya, Honorable Governor, Tamil Nadu, Sri Bandaru Dattatray, our Honorable Minister of State Independent Charge for Labour and Employment, Sri Pon Radhakrishnan, Honorable Minister of State for Road Transport and Highways, Government of India, Sri P. Mohan, Honorable Labour Minister, Government of Tamil Nadu, Sri S.P. Velumani, Honorable Minister of Municipal Administration, Rural Development, Government of Tamil Nadu, Dr. C. Vijay Bhaskar, Honorable Health Minister, Government of Tamil Nadu, Sri P. Nagarajan, Honorable Member of Parliament, Lok Sabha, and all other dignitaries, officials of Ministry of Labour and Employment, and ESIC, Government of India, and Government of Tamil Nadu, friends from the media, and other distinguished guests. Over the years, ESIC, with its efficiency and progress, has earned a name for itself. The growth of ESIC as the leading social security organization of the country is now evident with the inauguration of this medical college by Honorable Prime Minister. I would once again like to reiterate our commitment to provide the best possible services to our beneficiaries so that they are healthy and productive and are able to give their best for the development of our national economy. With these words, I again thank all of you and convey my best wishes and greetings, sir. Thank you, sir.